Greetings, I'm Dike Rostant. Welcome back to the TTT News. International Nurses Day is to be observed on May 12 with the theme of A Voice to Lead, Invest in Nursing, and Respect Rights to Secure Global Health. To help us understand some of the things we should be focusing on a bit more, we are joined by Avion Drayton-Bailey, Chair of the Socio-economic Committee and Northern Branch of the TNT Registered Nurses Association, as well as President Stuart. I want to welcome you and thank you for the work that you have been doing before and during the pandemic. But I want to start off with you, please, Ms. Drayton-Bailey, in terms of what does the week highlight and what does the theme seek to address?
Hi, good afternoon, everyone. So I would just like to say Happy Nurses Week to all the nurses and nursing personnel of Trinidad and Tobago. This is a very exciting time for us, just coming out of our pandemic. Yes, we are still in, but we are on the downside. And this year, we are hoping to see nurses lead and let everyone hear their voices. We have worked hard for the last 2 years, and we are looking forward to reaping the benefits. Our country would have seen all our efforts, and this year, it's our year. We are celebrating Christmas this week. This is our Christmas. So we are looking forward to, seeing the population continue to get healthy. We're looking to see our cases of corona go down, and we are looking forward to see nurses being promoted in not just in the hospital and healthcare setting, but also in society, because our voices are important. And we are here, as our theme says, we are a voice to lead, and that's what we're looking forward to this year.
Thank you so much. And Mr. President, some peppery question for you now. What was the state of play in terms of nursing in Trinidad and Tobago at this point in time?
Well, firstly, we would really want to commend our nursing personnel and midwifery personnel who would have been doing such yeoman service over the years, despite some difficult situations that nursing and midwifery personnel have been placed in. While our foreign countries continue to recruit nurses in mass, Trinidad and Tobago is sadly undervaluing our nursing personnel. Nursing personnel, some 3,400 nursing personnel are still temporarily employed within our health sector. They are not entitled to gratuity payments, not entitled to pension payments. Nursing personnel are still working on 2013 salaries in 2022, when everyone, including taxi drivers, are receiving increases. Nursing personnel are extremely short, even while we allow hundreds of nursing personnel to migrate to greener pastures. We in Trinidad and Tobago remain short and are constantly depleting our human resource, our best and brightest. And that is having a ripple effect throughout the health system, whereby the quality of care for nursing personnel, for the public by extension, delivered by nursing personnel would be depreciating, not because we want to, it's because we are so stretched for resources. The pandemic did us no favors and has not brought us any greater benefits, despite the promises and admiration from the government. No said reflection has come the way of nursing personnel. So it's a difficult situation. We are trying to lobby the Ministry of Education to increase the standard and quality of education by having a minimum degree to practice nursing. Hopefully that comes on stream. And we also trying to rationalize nursing employment. So a lot has to be done. And the association, from the association standpoint, we would continue doing the work because we believe the citizens of Trinidad and Tobago deserve a healthcare that they could be proud of, healthcare that is responsive, timely, efficient, effective, because a lot of money goes into the health sector. So we really continue to support ICN's nursing team, nurses, a voice to lead, invest in nursing, and respect the rights to secure global health. So that is our main goal, to get the government to invest in nursing.
And
Yeah.
what are some of those greener pastures that you're talking about that nurses locally are leaving for President Stewart?
Well, the three big drawing right now for nursing personnel are the United Kingdom, United States, and Canada currently. And they are pulling our nurses in mass, as I indicated. The offer is so sweet right now. While Trinidad and Tobago doesn't see the need to offer gratuity or pension to nursing personnel who migrate to the UK and they work in the UK, they get a pension after 10 years service. They get gratuity at the end of their contract. They get, they're actually recruiting your whole family to go up. So it is making the decision for nursing personnel to migrate that much easier, because now you can take your children, your spouse up with you, and the UK will house them for you, even while your government don't find you don't deserve a HCC house because you can't afford a house on the private sector market. The government makes no provision for nursing and midwifery personnel in Trinidad and Tobago. So this is some of the investments we are asking for. We are asking government to invest in nursing education, address the nursing shortage, provide positive practice environment for nursing personnel to work within, adequate remuneration. All other sectors are engaged in negotiations as we speak, with the exception of nursing and midwifery personnel. We're saying
while you
involve
talk about
nurses.
remuneration, let me ask Mrs. Drayton-Bailey, what is the purpose of the socio-economic branch? Because I hear it, but explain it to me, thank you. Or the committee, rather.
Okay, so a lot of persons tend to think that nurses make very high equivalent salaries, which is not very true. We tend to be very prudent with the salaries that we have. However, because of the pandemic, lots of persons would have lost their jobs, not specifically the nurses, because for sure we were definitely essential during this pandemic, but members of their household, their husbands, their children, all other income earners, they might have lost their income based on whatever jobs they were doing. And then this put a strain on the nurse who was the one breadwinner in the family. So this one salary now had to pay mortgage, pay rent, pay light bill, buy the groceries, whatever it is. And it became very, very difficult for our nursing personnel. They also would have had children who, because there was no school, was at home. They had to invest in tablets and other electronics and so forth. And it really was a strain for some of them. So TTRNA, we have this socio-economic committee of which I'm chair, in that any nurse who is going through any hard time, they can apply to us, they can plead their case, and then we would see what we can do. We can't always address and help everyone. We may not be able to give the amount that they may ask for, but we try to help. So we would have donated tablets to nursing personnel who just could not afford to purchase one for their child. We would have had a nurse who is now home with stage 4 cancer and is no longer able to bring in an income. And we would have provided groceries, and other, personal use items for her. And a number of things. We help persons who have funerals, deaths, that unexpected deaths. We really try to help. As I said, we can't always do it for everyone. After all, TTRNA, we get our income from dues, from membership dues. So we can't just go spending it willy-nilly. But because they are our members and they are persons who would have paid dues over the years, we try to see how we can help them in this crisis.
And we continue to celebrate our nurses while still looking at the stark realities of their existence. We return to this conversation in just a bit. Stay with us. Welcome back. We are celebrating our nurses during this period of Nurses Christmas, as it has been described. And we are speaking with Avion Drayton-Bailey, Chair of the Northern Branch, as well as President Edie Stuart of the Trinidad and Tobago Registered Nurses Association. And how do nurses enter the fold? And I asked that question, please, Mr. Stuart, I'll ask you, because you were talking about having things put in place in terms of a minimum degree to practice nursing. So what is the current, what's the current set of logistics?
So currently, one would require 5 CXC passes, a numerical subject, English language, and 3 others. And you would enter nursing school. There are currently 4 nursing schools, and 3 of those 4 nursing schools actually offer a registered, they are registered with the Accreditation Council of Trinidad and Tobago, which is the law which states anyone who's offering any institution who's offering a post-secondary or tertiary level program, they must be registered with the Accreditation Council of Trinidad and Tobago. Sadly, the fourth nursing school, which is actually run by the very government who has set this law in place, is running a program that is not registered. So that program carries with it a certificate at the end of the program. It's really unfair for those persons who go through that program to go through almost the same length of program as their counterparts in UE, USC, and COSTAT, and they would come out with a certificate while the others come out with a degree, associate degree in case of COSTAT. So this is why we would have approached the Minister of Education and to try to resolve this anomaly. Nursing personnel, as we speak, it is not mandatory for you to have a degree. Unfortunately, even though the government of Trinidad and Tobago would have signed on to a CARICOM agreement in excess of 15 years ago, stating that all nurses within the Caribbean would graduate with a minimum of a bachelor's in nursing. And it's only to date 2 countries in the whole of the Caribbean are not at that level, which is Trinidad and Tobago and Guyana. Unfortunately, all other countries in the region and in the wider nursing diaspora in the international space are already at the degree level. And we are lobbying the government to let us raise the standard of nursing education in Trinidad and Tobago. Let us be within the fold of all other healthcare professionals, which currently are trained at the degree level. Doctors, social workers, pharmacists, veterinarians, dentists, all other healthcare workers are trained at the degree level. So we cannot understand why a profession such as nursing, the government is taking a deliberate action to reduce the quality of nursing education.
And do you think sometimes this is why you may have some schism between other medical professionals and nurses? No, I will say I have seen doctors acknowledge the value that nurses bring to the table, nurses and midwives, but I've also seen some doctors, it seems as though, wait, now I have my paper, so you can't tell me nothing. Use just a nurse. Do you think that's part of the reason?
It's one of many reasons, definitely. And that is why we as an association is trying to change the mindset of the colleagues we work with, the colleagues right within our own profession, and most importantly, the public's image of the nurse and also the government by extension, how they view nursing. We were actually told, we were actually in several meetings with government officials, and their response to us, what is the need for a nurse to have a degree? This is the still thinking in our country. So we want to get out of that predicament where the government is restricting our development. The world has already moved in that direction. We are 20 years behind the curve. So we really need to get to that level and get our nursing personnel to the same level as other healthcare professionals. And it's also done deliberately to reduce, to keep and suppress the nurse's salary. Because from the minute you qualify with a degree, then it's incumbent on the government to pay you a certain wage. And this is the reason why teachers also went through the same growing pains to reach to that level where all teachers who you probably interact with going forward, probably 98% of all teachers are at the degree level. And we always make the comparison to teach um, tertiary or secondary, primary, even preschool teachers have degrees now to teach preschoolers and to save someone's life in our nation hospitals, you do not need a degree. A certificate will do in the eyes of the government. So we are seeking to treat with that, and we remain positive as
Mhm.
we lobby the Minister of Health and the Minister of Education in these pursuits of the association.
And with that in mind, Ms. Drayton-Bailey, lay it out for us. How does improving the way that nurses are treated in TNT improve the entire local healthcare system?
Well, one, it will build the nurses' confidence because some of them, they suffer from poor self-esteem because they think that the public, is always down on them. One of the things we know is that there seems to be a love-hate relationship between nurses and the public. Now, nurses are there from birth to death. From the time you're born, you interact with a nurse, go straight through your school years, till afterwards, till death. We play a vital role in society. We believe if nurses are given the respect they are due and, allowed to be a voice to lead, as we said, then you would see so much more because nurses see about persons holistically. We don't just deal with a disease, we deal with the socio-economic part, we deal with mental health, we deal with psychosocial, psychological. Many times, sometimes we have patients on a bed and they have high blood pressure and you would give them all their medication and so forth and the pressure isn't going down, but sometimes it takes the nurse to realize that the person just realized that I mightn't be able to work again. I mightn't be able to pay rent this month, and no matter what medication you're giving them, their blood pressure will not go down, and therefore it's up to the nurse to let the doctors know that this person needs a referral to the social worker or some other entity who can help them holistically to meet their need. So nurses going forward, they really play a vital role in persons' lives. We see everything from children at school, children here in the hospital having babies, to rapes, to everything. The nurses are exposed to it and they all know the solution, but sometimes they don't have that
You even
confidence
know.
to move forward to
And
sometimes they don't have that confidence to go forward because they think that their opinion doesn't matter. And what we are really trying to do is build the confidence of all our nursing personnel and let the public know that nurses are well capable to manage their care holistically.
And this is actually one of the reasons that I celebrate you, or we celebrate you at this point in time. One of my four grannies, I say I have four grandmothers, and one of them is the midwife who actually delivered us. But we want to thank you so much, Eddie Stuart, President, and Avion Drayton-Bailey, Chair of the Socio-economic Committee, as well as Chair of the Northern Branch of the TTRNA. And on behalf of the entire TTT News team, this has been In Depth with me, Dike Rostant. Thank you for joining us.